Hi, welcome to the Animal Wellness Center of Maple Grove's YouTube channel. I'm Dr. Ambrose, and this is Sarah, one of our wonderful certified veterinary technicians. If you're watching this video, your pet has probably been diagnosed with diabetes mellitus, or the inability to independently control their blood glucose levels. One of our veterinarians has likely prescribed insulin injections to be given at home to help your pet manage their blood glucose levels. One of our goals today is to show you how safe and simple it is to give these insulin injections to your pet at home. Insulin comes in a small bottle that can be stored in the refrigerator. Make sure the bottle is not exposed to direct light or heat, and do not use insulin that is past its expiration date indicated on the side of the bottle. If your insulin is accidentally frozen, discard that bottle as the insulin will be damaged. When you first remove the bottle from the fridge, you may see a white precipitate that has formed at the bottom. Gently roll the bottle between your hands to disperse this precipitate. Do not shake or heat the bottle, as this can also damage the insulin. Your veterinarian has also prescribed special insulin syringes that are labeled with the number of units per dose. These syringes correspond to the type of insulin that your pet is prescribed, so you should use only these syringes. Depending on the type of insulin, the concentration will either be U100, and your syringes will also indicate U100, or they will say U40, in which case your syringes and syringe box will say U40. It is extremely important that you use the corresponding syringe to give the correct dose, and we will be happy to confirm this with you during your demonstration appointment. Draw up your pet's insulin dose. Remove the plastic cap from the needle and set aside, because you'll need it later, so keep track of it, and remove the plastic end cap from the plunger. Then invert the insulin bottle and insert the insulin needle all the way up to the hub. Holding the bottle vertically upside down helps to minimize air bubbles. Then draw back on the plunger to your pet's correct dose. I like to draw back a little farther than my pet's dose and then gently flick out any air bubbles that may have gotten into the syringe. Then I can push them out as I push my plunger back to my pet's correct dose. This helps to minimize dosing error. Then remove the needle from the insulin bottle. It is important to select a calm, relaxing location for your pet and have plenty of positive reinforcement ready, such as some catnip or your dog's favorite treat. By making the insulin injection a rewarding experience, you will have a very compliant pet in the long term. For your comfort at first, you may wish to have two people ready, one person to hold and praise your pet and the other to give the injection. Pretty soon, though, you will be confidently giving insulin injections on your own in just a few seconds. You will always give an insulin injection shortly after a meal, so start by feeding your dog or cat their breakfast or dinner. If they will not eat, or they've been experiencing any other symptoms such as vomiting or lethargy, don't give the insulin injection and instead give us a call. Once they have eaten a good meal, then calmly stroke your pet and gently but firmly pick up a section of skin between the shoulder blades. Feel free to pick a slightly different area each time for your pet. You will see that this forms a tent of skin where you will direct your needle. Place your needle in the center of the triangle and then gently but firmly and quickly push the needle through the skin. You'll notice that you have plenty of safe space with this technique to insert the needle, so don't worry that you're going to hit anything important like muscle or bone. You will feel a slight punch as you penetrate the skin, and this is good because you don't want your needle to get stuck in the skin or subcutaneous fat, so push it all the way up to the hub. Don't be shy. A brief, bold injection is safer and easier for your pet. Then depress the plunger and remove the needle in a smooth, quick motion. So like this. And done. If you are not sure if the insulin went in completely or if you feel moisture at the site of injection, do not administer a second dose. Rather, simply wait until the next dose is due, usually in 12 hours, and try again. If you are struggling at all, please do not hesitate to give us a call, as we are always happy to troubleshoot with you. It is especially important not to be shy with your injections on large dogs with really thick skin, because the needle is so small, and it's important that the insulin gets all the way under the skin. So again, pick up a section of skin, identify your tent, aim for the middle of the tent, punch all the way through to the hub, inject, and come out. After the injection, replace the orange cap back on the needle very carefully so you don't poke yourself, and then place the used syringe in a sealed, thick plastic container, such as a milk jug or a used liquid laundry detergent bottle. When you've accumulated enough syringes, go ahead and reinforce the seal with some duct tape, and then you can discard of this in your regular trash. Then, make sure to put your insulin back in the fridge every time. You may want to do that right away in this process to make sure you don't forget. And finally, it's important to praise your pet after they've been so calm and good for their insulin injection. Over here, Austin. Good job. Thank you for watching our insulin injection demonstration. Hopefully our video will help you feel more prepared and confident in providing this simple but extremely beneficial treatment for your pet at home. And hopefully this video can also provide a good refresher should you need it. Please feel free to schedule a practice session with your pet at our clinic in the near future so that we may go over the technique and boost your confidence and safety here in our hospital. And of course, if you have any questions or concerns anytime, do not hesitate to give us a call at 763-420-7958.